Here to keep the chase going, share information, spread unity, preserve our heritage and our culture. We're trying to achieve something that you just can't catch. We're always trying to find a better way, trying to make better dogs. That's what Dixie Doggers Podcast is. That's who we are.
This episode is brought to you by Rankin Ranch 38 Cattle Company. Marc Rankin specializes in Brahma and Brahma Cross cattle in Oglethorpe County, Georgia. You can contact him at 407-832-2077. 407-832-2077. This episode is also brought to you by Phil Wilson of UC Hunting Properties. If you're buying or selling land, farms, or hunting property, these folks know land. You can contact him at 678-791-3483, 678-791-3483, or visit his website down below in the description. Canine hip dysplasia, CHD, is a genetic hip joint disease. Hip joints are ball and socket joints, and during the developmental stages, CHD can occur. Uniform growth does not cause CHD, but when these joints grow irregularly, the issues start arising. The ball of the femur or the femoral head will become deformed. The socket, known as the acetabulum, will also be deformed in a shallow or misshapen way. This allows for poor connection and poor function of the joint. This causes looseness or laxity in the joint, which can be followed by degenerative joint disease, DJD, or osteoarthritis, OA, which is the body's attempt to stabilize the loose hip joint. Also experience progressive loss of cartilage, the development of scar tissue around the joint, and the formation of osteophytes, bone spurs, around the ball and socket. This genetic disease is largely influenced by external environmental factors. These factors can include diet, environment, exercise, growth rate, muscle mass, and hormones. In a study conducted, a group of puppies at risk for hip dysplasia showed that when they were fed as much as they wanted to eat, 2/3 of the puppies went on to develop hip dysplasia. When they were fed measured meals, only 1/3 of the puppies developed hip dysplasia. A study of German Shepherds found that overweight puppies were almost twice as likely to develop hip dysplasia as their normal weight counterparts. Additional studies have shown that spaying or neutering at an early age may lead to an increased incidence of developing hip dysplasia in some dogs. Breeds for which hip dysplasia is a special concern include bulldogs, mastiffs, St. Bernards, basset hounds, bloodhounds, Newfoundlands, pit bulls, chow chows, Rottweiler, and Chesapeake Bay Terriers. So basically any kind of large or giant dog breed, anything that's going to get really bigger than 55, 60 pounds, I'd probably say has the potential. So some common signs include chronic or occasional lameness, limping with no previous trauma or injury, bunny hopping, particularly when climbing stairs, having trouble standing up, abnormal sitting positions, having trouble getting on and off furniture, going upstairs or jumping into cars, general lameness in dogs under a year, arthritis and or hindquarter muscle atrophy in older dogs. Dogs can be very stoic and may not show all these clinical signs. However, this condition is painful as it progresses regardless of whether your dog has symptoms. Most dogs don't develop clinical signs until later in life, once more progressive symptoms have set in. Treatment includes anti-inflammatory drugs, joint supplements, moderate daily exercise, avoiding high-impact activities, and physical therapy. Joint supplements commonly include ingredients like omega-3 fatty acids, glucosamine, methyl sulfone, methane, and chondroitin. There are several procedures that can be done for dogs under a year old and older dogs in severe cases. Please see your vet to get those recommendations. Anytime facing surgery, please get multiple opinions on effectiveness, cost, and long-term quality of life. A lot of dogs suffer from hip dysplasia, as they said, in silence for years and years until it progresses and gets to a point where it is bad. So one thing, if you have a breed of dogs or a line of dogs, or however you want to word it, if you have a dog with the potential and you see some of these issues in their lineage or see it in themselves, like I said, you can do several proactive treatments, supplements, daily exercise, stuff like that will keep them good and loose. Swimming's very good. It's good, easy on the joints, low impact. As always, All the citation links will be down below in the description. And if you ever have any questions, call a vet. If you ever have any emergencies, call a vet. Get multiple opinions and make sure you're making the best decision for your dog. Thank you. Hope y'all enjoyed that episode. Stay tuned for our new episodes every Monday and Wednesday. For questions, advertising, or just to chat, email DixieDoggers01@gmail.com.